Good morning, everyone. This is today's class is on flow cytometry. I will be discussing in brief about what is a flow cytometry, what are the principles, and what are the applications of flow cytometry. I'm sure all of you must have heard this term and how it is being used in leukemias and in patients of AIDS. So let's talk about what is flow cytometry. Flow cytometry is is a technique for cell counting and measuring the different properties of the cell. So cell counting and measuring different properties of the cell. Do you know in hematology we have an instrument which measures the different types of cells in hematology, about the different types of RBCs, neutrophils, lymphocytes, and platelets. So that is the same type of principle that we are going to use here, and we are going to use the fluorescent dye in that, and we're going to use the antibodies in addition to that. So let's see, it's a laser based technology that measures and analyzes different physical and chemical properties of the cells flowing in a stream of fluid through a beam of light. Okay, so how we are going to talk about the principle, and all these things will be discussed in detail in that. So it's a cell biology technique that utilizes the laser to count, sort, and profile cells in a heterogeneous fluid mixture. So these in this machine, the cells are suspended in a liquid stream of fluid, which is passed through a laser light in a single fashion, and with the result, it is detected by a electronic detection apparatus, which is used further in the principle of light scatter, which is forward scatter and the side scatter, which I'll be talking in detail. And then we will be using a fluorescent dye, which I have described just now. Now this is the instrument. This is the place. I think Beckman Coulter is the one which provides that, or I'm sure BD also provides that. So then this is the place where sample is placed, and next to it is the monitor on which the graphs and everything is placed, and we have to just sort out the graphs, and then we have to give the report based on different cells. So we know that we can count. The question should come into your mind that we can count lymphocytes, neutrophils, monocytes, and eosinophils on a normal cell counter. Why do we need a flow cytometry? Now if you count a lymphocyte, there are two types of lymphocytes. One is T lymphocyte, one is B lymphocyte. So on a smear or on a simple machine, you cannot say this is a T or a B lymphocyte, and you cannot predict the different antigens or the CD markers which are present on the surfaces. And these are particularly useful in diseases like the leukemias, when we are not sure whether this is a myeloid cell, or this is a monocytoid type of blast, or this is some other type of blast like megakaryocyte type of blast, in which we want the specific identification and a confirmation that whatever we are seeing on a slide is definitely a blast of monocytoid series. So in that case, we need typical markers, like monocytoid will carry 16 and 56 markers, CD markers, and then myeloid will get 13 and 33 cell markers, and T lymphocyte will carry different 3, 5, 7 markers. So these are different type of markers that we are being using them in the laboratory to say about the different leukemias which are present in the patient. So depending upon the history, you can say it all started with Leeuwenhoek with the discovery of the light microscope in 17th century, and then in 1965 you can come directly, in which the Coulter principle was first established. And now in 1970s, you can say there is a fluorescent based techniques, or a flow cytometry has been discovered. So what are the principles? The first one is the Coulter principle. Okay, the Coulter principle is the same principle that is used in a normal Beckman Coulter for the normal hematology parameters. Then we have the laminar flow, then electrostats, then light scatter, and then there is a flow cytometry. So I'll be talking in detail about these different mechanisms now. So there are three components of the flow cytometry. The first one is the fluidics. The fluidics is the one which transport the particles in a laser beam for interrogation. They move in a straight line for some time, and before they are hit by the optics, that is the light. So fluid system is it takes a sample and make them flow in a laminar flow in a straight line. Then comes the optics. Optics is the one which will be throwing the light on these particles, so that the signals are sent from these cells. So there are two types of signals: forward scatter and side scatter, which I'll be talking later. Then we have the proper detectors which can detect the signals. Okay, then the electronic system is the one which converts these light signals into electrical signals, which is then processed by the computer. These signals are converted into a graph, or these dots are getting converted into graphs, and then we can sort out the different types of cells, and a decision can be made on the presence of the different type of leukemias or the blasts which are present in the system. Now the first one is a fluidic system. This fluidic system is the one which transport the particles in a straight or a stream of fluid in the laser beam where they are interrogated. Okay, so all these particles of the cells, they are between 0.2 to 150 micrometers in size, and if there is a solid tissue, it will get disintegrated before they get analyzed. So if it is like a bacteria or a fungi which has the chromosome of the nuclei, which can also be examined. So some particles, some algae, or they emit fluorescence, so there is no need for special fluorescent in those cases. So this place is known as a sample core, in which the sample is being aspirated and made to follow in a straight line. Okay, which is also known as a sheath fluid, or which is passed through a nose. Now you can see here in this picture, there is a sample which is coming here through this stream of a straight line. Now in this, it is coming down, and then it is going towards the nozzle, and before the nozzle, the light from the left side is getting hit on these particles, and which is doing the forward scatter and the side scatter. And before they get into that nozzle, we are actually staining these cells. There can be a direct staining or indirect staining. Direct staining, the antibodies are directly conjugated to the particles, which has a fluorophore on the surface. So antibodies will have that fluorescent dye on them before we bind them on the antigens. Now indirect is the primary antibody is already there on the cell. Now we have a secondary antibody which has the dye, which will get conjugated to the primary antibody. Then we can dye the antigens intracellularly also. So now look at the picture. Now we have this antibodies which are being on the particles, and these are passing through the nozzle, and then the light laser here is being thrown on those particles, which is showing a forward scatter. FSC means a forward scatter, and the SSC means a side scatter, which is there over there. And then we have the fluid droplets, then we have the positive sample and the negative sample can be seen. Now the optical system is made up of lasers, which just through the light on these particles. So any fluorescent molecule will emit light based on this optical system. So now you can see in this picture there's a light path, and these are the different cells which are present here, and they will show on the straight line is a forward scatter, and on the sides it is based on side scatter. Now you should know why does the forward scatter happens and why does the side scatter happens. Now the forward scatter is based on the size of the cell. Okay, so which is the largest granulocyte which is present inside the body? It's a neutrophil and eosinophil. So they are the biggest cells, so they will scatter the most in the forward line, in the straight line. Now the granules, let's look at the granules. If the which of the cells has the granules? Which are the cells? The neutrophils and eosinophils only we have the granulocytes. Now because of these granulocytes, there will be more side scatter. Okay, lymphocytes and monocytes will not have granules, so they will have a lesser side scatter. Okay, and even the basophils has a neutrophil, so huge amount of side scatter will be there. So based on the scatter, we can find out the count of the different types of the cells, and then the markers, if they are present on the surface, they will emit light, and when they emit light, they will be converted into light energy to electronic energy, and that will get converted into a graph. Okay, so which is the work of the electronic system which is present in the computer? There is a software present in the computer which will count the number of cells and see and sort out the different types of cells, and catch the signals all the of the fluorescent dyes, and then convert it into a graph. Now let us talk about this. Now you can see on the x-axis is the forward scatter, and on the y-axis is the side scatter. Now if you see the biggest black diagram above, you can see there is a forward scatter also, because it is in the right upper side. Okay, so it is showing both forward scatter and the side scatter. The central one is the forward scatter, the surrounding one is a side scatter. So that is why it is a neutrophil. It's the granulocytes which has the granules. So both forward and side scatter can be seen in neutrophils, eosinophils and basophils. Now if you come down to the right side, you can see monocytes. Now monocytes are showing more of the forward scatter and less of the side scatter. It is not towards the y-axis, it is towards the x-axis. So this is showing a forward scatter. And if you still follow the trail of the monocyte, there is a big lymphocytic range which is showing a thick population of these lymphocytes, and this is known as a forward scatter, and there is very less side scatter in that. So each dot represents a single cell analyzed by a flow cytometer. So all right, so this is how we see the different types of the cells. So I'll just revise. We have the first one was the fluid system through which the cells are passing along with the antibody. Then we have the optical system, in which the light is being thrown and the elements are getting scattered, and when they are scattered we have a forward scatter and a side scatter. Forward based on the size, side based on the granules inside the cells. And then we have the electronic system, which will convert the light energy into electronic energy, electronic pulses we can say, and that the computer can process, and we can get the graph, and then we can give the report to the patient. Do you know there are so many indications, especially in HIV also, that HIV infects the CD4 T lymphocytes. So if we want to count the number of CD4 T lymphocytes, we send the sample for flow cytometry. Why? Because if the count is less than 500, obviously the patient will have a superadded infections. If the count is less than 200, it is dangerous for the patient. So the count is being monitored in all the HIV or AIDS patients. So flow cytometry is being used, because a normal system cannot say this is a CD4 or a CD8 lymphocytes. And HIV is very, very classically, they will infect only CD4 cells. So this is how the flow cytometry and its uses were invented. So let's talk about more about the applications of flow cytometry. Now I've discussed with you before also, if you want to differentiate between a lymphoid or a myeloid malignancy, especially in the undifferentiated leukemias or biphenotypic leukemias, in which the morphology is not very clear. We can easily differentiate morphology on HNE. We can say that this is with the granules it is a myeloid, without granules it is lymphoid, and depends upon the coarse chromatin, we can say this is lymphoblast, and fine chromatin is a myeloblast. But sometimes in conditions like undifferentiated leukemias or biphenotypic leukemias, it's very difficult to understand sometimes the morphology. So the best is to send them for flow cytometry. They will put the markers for both lymphoid and myeloid, lymphoid 357 and myeloid 1333117, and then whatever picks it up on the flow cytometry. So at a time we can add 6 markers at a time, and we can sort it out whether this is a myeloid or a lymphoid, because then the treatment is totally different for myeloid and lymphoids. This is how we have to understand this. Now the cell sorting is to measure the different types of the cells. Okay, so sorting out the cells, so whether it's CD4 or CD8. Then we have a DNA content. It's sometimes we in some of the tumors, solid tumors, we have hyperploidy or hypoploidy, so we can measure the amount of DNA inside the chromosomes, and then we can say about the prognosis of the patient. The next one is a cell cycle. Cell cycle also we can say which phase in it is, G phase, S phase, that also we can measure. Then with the apoptosis we have to know as a marker, and then cell proliferation. We can say that BCL2 and BCL6 inside the follicular lymphomas, it's very, very important. And even in the blood banking, it has a very important use, especially in the irradiated patients. In the irradiated patients, we don't have any immune cells. So if you want to transfuse a PRBCs, which is a RBCs concentrates, so what we don't want to infuse any sort of leukocytes, because again, if you infuse a leukocyte, there will be a immunological reaction or a transfusion reaction or a GVHD. So what happens is we just don't let that happen. We run the whole bag or a small sample through flow cytometry to understand the number of leukocytes, and if it is more, we again centrifuge and try to take out all the buffy coat from it, and then we make sure that we just try to give 95% of the PRBCs into the patient. Okay, so this is what it has a big indication in blood banking as well, especially in the transplant patients. And then leukemias, lymphomas, and even in the systemic mastocytosis we have markers, reticulocyte count, antiplatelet antibodies, anti-neutrophilic antibodies. So all these are being used for specific reasons and specific diseases. Now, fluorescent activated cell sorting, I think it's the same thing, in which we use two types of dyes, FITC and PE. This is very commonly used for CD4 and CD8, and you should understand that FITC works at a wavelength of 519 and PE works at a wavelength of 575. So we put them into CD4 and CD8, and whichever emits the large number, so that is how the number and the type of cells can be counted. So this is another picture of the whole thing. You can just go through it again and understand that we have just run the sample and how the forward scatter and the side scatter has happened along with the fluorescent dye. Now the DNA content I've spoken, aneuploidy and polyploidy, cell cycle analysis can be done. Ecology also can be understood in some plant morphology or microorganisms. It also can be used. In the cancer research, it has been used extensively nowadays, especially in the lymphomas also. It has a very good diagnostic feature. You can say that it is very commonly used to measure, to differentiate between CLL and mantle cell lymphoma. In CLL, the morphology is almost similar to MCL, but in CLL what happens is it is positive for 5 CD5 and 23, but in mantle cell lymphoma it is positive for 5 but negative for 23. So this is how you differentiate between both of them. But sometimes MCL or mantle cell will still show some weak positivity towards CD23. In those cases, we use 11C, which is specific for mantle cell and which will be negative in CLL. So this is how it has been used in different conditions, particularly in hematology, leukemias, lymphomas. So immunophenotyping is just another name for it, and we can sort out different types of cells. So I think it is pretty interesting, not difficult, and just go through it once more, going through your book, so that you can have a deep understanding. And this is an exam question, it is important. And all the best. This is Dr. Amrit. I'm a professor of pathology, and please get back to me if you have any problems in understanding. As I always say, I feel like a radio jockey here. I do not know whether my students have understood or not, and because I'm ready to explain it once more if it is required. All right, so thank you so much, and again, please practice it again and again, and wish you all the best.